Hi there and welcome to the Dermatology Series. In this we're going to be breaking down different dermatology conditions, and this week we're going to be breaking down Lyme disease. Now, Lyme disease is a bacterial infection. It's spread to humans by infected ticks. So it's caused by the spirochete Borrelia burgdorferi, which is spread by ticks. Now, it's seen more commonly in the summer months as well, which is something to note. Okay, so we're going to move on to how Lyme disease presents. Now, not everybody that's infected will show symptoms, and moving on to, the symptoms that people will show. Now, erythema migrans is known as the bullseye rash, and this is seen in 80% of patients, and this is very much the buzzword that you'll see within exams. A patient presents with a bullseye rash, after hill walking, this kind of thing, where they've been bitten by a tick. Now, this bullseye rash is round or a kind of oval shape. It's got central erythema with sparing around the edges, and it's usually got a diameter of more than 5 centimeters. Now, the nature of this rash really depends on where the bite was acquired. Interestingly to note, in the US, seeing this kind of typical bullseye rash is actually not as common as it would be in the UK. Now, moving on to other kind of symptoms that we see, patients may have associated fever or painful joints. With regards to, the neurological complications as such, only 10% of untreated cases will have some kind of neurological symptom as such. In Europe, this is the second most common presentation to after erythema migrans. Now, kind of neurological things that we may see can be facial nerve palsies and meningitis. Moving on further to cardiovascular complications. Now, this is actually quite rare in the UK, but patients may experience myopericarditis or heart block, which obviously is something that's extremely serious. Moving on to, how do we investigate Lyme disease? Now, it's often diagnosed clinically by the site of this bullseye rash, so erythema migrans, and if we see this rash, doctors are meant to start antibiotics as soon as possible. However, if we're wanting to diagnose, then the first line investigation is ELISA, which is enzyme-linked immunosorbent assay, and essentially this is how we would diagnose Lyme disease if we were unsure clinically. As far as the management, the first line would be doxycycline, and the alternative would be amoxicillin. Now, this sums up everything for Lyme disease. If you guys enjoyed this video, please give it a like and share to any of your friends that you think would benefit from learning from this. Let us know as well if there's anything that we can improve on, any other videos that you want to see. Please don't forget to comment below and subscribe. Thank you so much.